This is PediaCast CME.
Welcome to PediaCast CME, a pediatric podcast for providers. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast CME. It is a continuing medical education podcast for healthcare providers. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 88 for July 25th, 2023. We're calling this one Functional Rehabilitation for Student Athletes. I want to welcome all of you to the program. So we have another CME activity for you this week as we consider functional rehabilitation for student athletes. It's a common occurrence, right? Student athletes get hurt while playing their sport or while training or even during the off season. They might complain of recurrent pain, such as a baseball pitcher's throwing arm or the swimmer's shoulders or the gymnast's ankles, back, and wrists. Maybe it's a football player or a lacrosse or hockey player who suffers a concussion. Golf swings, running styles, throwing mechanics, for those handling maybe the shot put or discus. Lots and lots of activities related to sports participation can result in repetitive motion injuries, sprains and strains, stress fractures, and head injuries. Student athletes, of course, want to get back to their sport as quickly as possible. However, without the right guidance, they can easily re-injure themselves, which begins a pattern of recurrent injury and pain that robs them of love for their sport. Or they may sustain another injury, perhaps at a different location, secondary to mechanics that were meant to compensate for an injury, but they are not proper mechanics, and another injury ensues. So functional rehabilitation gets student athletes back to the playing field safely and efficiently, but it also focuses on performance enhancement and injury prevention. So this is an important topic for anyone who takes care of student athletes in any capacity. And we have a couple of terrific guests to join us on our journey. Eric Leighton is an athletic trainer with Nationwide Children's Hospital, and Jesse Parthemore is also a certified athletic trainer at Nationwide Children's. Before we get to them, let's cover our usual quick reminders. Don't forget you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. Also, please consider leaving a review wherever you get your podcasts so that others who come along looking for free continuing medical education credit will know what to expect. Speaking of that credit, it's really easy to claim yours. Simply listen to the podcast, which you are about to do, and then head over to the show notes for this episode at PediaCastCME.org. You'll find a link to the post-test in the show notes. Follow that link to Cloud CME, take and pass the post-test, and the Category 1 credit is yours. It's not only CME, we also offer CE credit. So any pediatric professionals, not only doctors, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And we are jointly accredited by all of those professional organizations. So it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of this episode matches your scope of practice. Complete details are available at PediaCastCME.org. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, Threads, and LinkedIn. Simply search for PediaCast. And don't forget about that handy contact page over at PediaCastCME.org if you would like to suggest a future topic for the program. I also want to remind you the information presented in our podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCastCME.org. So let's take a quick break. We'll get Eric Leighton and Jesse Parthemore settled into the studio, and then we will be back to talk about functional rehabilitation for student athletes. It's coming up right after this. Eric Leighton and Jesse Parthemore are certified athletic trainers with our sports medicine program. Both have a passion for helping student athletes return to the playing field following an injury. They accomplish this through our hospital's functional rehabilitation program. That's what they're here to talk about, functional rehabilitation and the many ways it can impact the health and performance of student athletes. But first, let's give a warm PediaCast welcome to our guests, Eric Leighton and Jesse Parthemore. Thank you both so much for visiting us today.
Thank you, Dr. Mike. We appreciate it.
Thanks for having us. Excited to talk about it today.
Yeah, and I'm very excited to have both of you here. I think this is the first time that we've had two athletic trainers as guests here on PediaCast CME. But you guys, you are the experts at functional rehabilitation, and so we are going to learn about what you guys do and why this is so important. And I think a great place to start, Eric, is just with a definition of the term functional rehabilitation. What does that mean as we consider student athletes?
Yeah, well, with student athletes, I mean, functional rehabilitation was born out of the need for a way to bridge that gap. Athletes that would get hurt, whether it was an ankle sprain up to a concussion, would go through traditional outpatient therapy, which addressed all of their needs and got them back to activities of daily life pain-free. But what was missing back then was that next step, getting them back into the rigors of athletics as we know it, and everything it requires to do that. So we look at literally the functional ability to perform the physical tasks necessary for their sport.
Because in addition to just having the injury, there's really whole body deconditioning that can occur if you have an injury that takes a long time to get better, right?
Oh, very much so. The body will always look for the easy way out. We all know the body wants to conserve energy. So if you're not using something, that old phrase of you don't use it, you lose it. But yeah, you have to stay sharp with workouts and with anything you do. The skills, not only the coordination, the skills, but to your point, the endurance, the strength, the flexibility. Yeah, those are all things that if they aren't maintained, you can lose them pretty quickly. You can detrain, as we call it, within a couple of weeks. We all know it feels like it takes months to get in shape during preseason, but you can lose it fairly quickly.
Yeah. And that's a unsettling thing that it takes so long to get it back, and yet you lose it so quickly. And that can be an issue over the summer. And so we see a lot of kids, especially in those fall sports, maybe have injuries because they didn't do a good conditioning program before the season started. And then you may end up with an injury and then that functional rehab to kind of get back to your pre-injury level, or even build back better to help prevent re-injury. One other thing I wanted to point out, a lot of times when student athletes have an injury, they will compensate for that injury, but then that can lead to additional injuries because now they're using muscles and joints in a way in which they weren't using them before because they're compensating for that injury. So do you see those kind of things happening as well?
Oh, yeah. You see that all the time. Probably the easiest and most obvious example of that, and I think we all see it everywhere, is, for instance, someone sprains an ankle. Well, of course, you start limping. Your body is trying to keep weight off of that joint. But by doing that, as you said, you're using muscles incorrectly. By limping, you're using lower back muscles, upper back muscles, hip muscles in ways they really aren't designed to do. The body will try to find a way around it, and it works temporarily. But yeah, that does cause more problems down the road. A classic trope for us as athletic trainers out in the schools, really with any athletics, if they come into our training room limping, we tell, hey, if you can't knock it off, if you can't walk straight, you're getting crutches. Yeah, because otherwise we wind up dealing with a whole nother injury after we resolve this first one. Yeah,
absolutely. I'm just going to run through some of the really basic, and we're going to dive deeper into this, but it's a pretty, as I was reading through the information about what you guys do, it is a pretty aggressive sports therapy program that really starts with an evaluation, and you're looking at biomechanical issues, the athlete's strength, their flexibility, their range of motion, the functional movement, meaning the movements that they need for their particular sport. So you're evaluating all of that, and then you're really working on all the aspects. So flexibility, muscle strength, power, balance, agility, cardiovascular performance, endurance. I mean, all of those things really fit into the functional rehab program. Am I right about that? Because that is a lot. And I would imagine that it's pretty difficult for students to get through this.
Yeah, it can be. But you're right. We do. We look for all of those things during our evaluation because they all affect the next part, and all those systems have to work together. I always describe it to a lot of the kids too. I said, if you're trying to pull off a certain play in soccer or in like you're doing a corner kick and the guy sends it in from the corner, but the guys up at the goal who are supposed to be paying attention aren't. If things aren't coordinating and working together, the whole system could start to fall apart. And yeah, you don't have that function. So we're looking for all of the things that affect it, the flexibility, the strength, as you mentioned, the timing. A classic example when we work with throwers, something we'll talk about down here in a little bit, is if the muscles don't work in the right sequence, in the right pattern, it leads to some severe dysfunction.
Yeah, absolutely. Now, like so many things at Nationwide Children's Hospital and across the country in a lot of programs, really there's a team approach. So the athletic trainers are really the day-to-day, I want to say workhorses for functional rehab, but you are a part of a team, right? What other team members help you guys out?
Well, it generally starts with our sports medicine physicians. Most of our patients will come in to our sports medicine clinic due to an injury. They realize they need help and they need to get it evaluated. Sometimes it starts as far back as the emergency department or an urgent care. They're seen, making sure that it's not dangerous, then referred to sports med and so on. But yes, it's the physicians, it's the physical therapists as well. We quite often share patients through physical therapy, depending on the level, then gets to us. We also have our dietitian. We have a sports medicine dietitian who can also really help because a very common thing nowadays is underfueling. And if you're not putting enough fuel into the system, again, the system will try to find a way around it. And it'll start robbing from everything from other muscle tissue, connective tissues, and even bone. So you're right. There's an entire team approach.
Yeah. And physical therapy, are they ever involved in this?
They are. For instance, probably one of the ones we cross over the most with physical therapy is with ACL injuries, for instance. It's probably one of the most common we work with. So after their surgery, their post-op appointment, they'll generally start with our physical therapy team and the sports physical therapy, and get them back to ADLs and into the beginnings of function. About 3.5, sometimes 4 months, depending on the level of injury. Then they transition into their functional brace and over to us, where we continue to take them all the way back up to playing.
Yeah. From the primary care physician's point of view, they just need to make a referral to sports medicine, right? And then you guys figure out like who they need to see and when they need to see them and all of that. So we don't necessarily have to remember, if it's ACL, go to physical therapy first, just sports medicine. And then from there, they're going to get directed into the correct program. Am I right about that?
Yeah, exactly. Yeah, we're going to take a look at what all's involved in the injury, and knowing, having done this, we know what they're going to need, where they're going to need to start. But yeah, exactly. They get them to us, and we can make sure they get to the proper care with a proper department and into the right order. Yeah. Jesse, I want to pull you in. Who benefits from functional rehabilitation? I'm sure that all student athletes, but are there particular injuries or particular things that make it more likely that an athlete is going to need the services that you provide?
Yeah, that's a good question. I would say what's really unique about functional rehab is a lot of the kids and patients that we see might have no issues at all with their activities of daily living, their normal everyday life. They may not have any pain or any deficits that they might notice. And so some kids that really are going to need functional rehab are those kids that are physically active and they're participating in their sport and they begin to have some pain or some ailments. And so getting into us, we can address what might be causing those issues and how we can get them back to playing at their expected level of performance, regardless of what's going on in their day-to-day activities.
Yeah. And really, it's an injury at any location, correct? Pretty much any injury, repetitive motion injuries, strains and sprains, stress fractures, all of them, and even head injuries, right?
Yeah, absolutely. We treat everything from the head to the toe. So if you're physically active and you're trying to get back to your sport and you're having issues, you're going to be an appropriate fit for functional rehab. And we address it based off of what you need to be able to do your sport.
And we'll also take care of, sometimes people will think of sports medicine and athletic training, and they default in their head to athlete, but it doesn't always have to be the kid heading back to the varsity or even JV or freshman field. as Jesse said, any physically active individual. That's who we work with. So, whether it's a young kid trying out sports for the first time or just doing a general workout or exercise for themselves, doesn't always have to be the traditional quote unquote athlete.
I mean, so even if you're involved in club sports, if you really enjoy pickup games of basketball with the neighborhood folks, and you have an injury that's preventing you from being active and having fun and playing the game, then that's going to be a good fit. And again, if you're listening to this, a good place for you to start, if you are a teenager who likes to play and has an injury, is really just your regular doctor, then to get you into the sports medicine folks. They're kind of the gatekeeper there. Let's talk a little bit about some specific programs that you guys have. And this is going to differ a little bit from community to community, but, a lot of children's hospitals across the country that have well-developed sports medicine programs are going to have similar things, because we have a lot of listeners outside of Ohio. But I wanted to talk about the depth of the programs that we have here. And then also, if you are a physician in another state, you can always take these and look and see what services are provided by the children's hospital near you. And then you'll have a greater understanding of what resources are available for your particular community. But here, I'm just going to start right up at the top. We mentioned concussions. Jesse, tell us about the concussion rehabilitation program at Nationwide Children's Hospital.
Yeah, so it's a very specific and very gradual return to play program. We'll get a kid in who has sustained a concussion. We'll get that referral from whichever provider they saw. And once they come in and see us, we'll do, again, a full evaluation. We'll look at their balance, their coordination. We'll do a functional movement screening just to see how they move as well, because we're going to train everything. But that starts with very small steps to make sure that we can get them back to moving without exacerbating their symptoms. So we're going to keep track of their symptoms. They're going to fill out a symptom log, and we can follow how they're doing both before the visit and after the visit. They're going to complete that at home as well, just so we can track their symptoms to see that they're improving and getting better. But starts very small with just light aerobic exercise, some stretching, some body weight movements. And it can range, anywhere from 4 to 6 steps, depending on how you look at it. But they're going to progress to some resistance training as their symptoms resolve. And from there, we'll add some light plyometric stuff, get them jumping, hopping, to make sure that they can tolerate that well as well. And then we'll move to more sport-specific movements once we get towards the end of that progression. Again, making sure that they're not getting any new symptoms, the symptoms aren't coming back, that they're, feeling well with exercise, getting that heart rate up to higher levels and maintaining that heart rate at a higher level. And then once we're at that point and they're doing well, then we can start doing some non-contact activities with their team, with their at their practices, where we're not allowing them to do anything that could cause a head injury. So it's a safe return, but they're able to then work on fundamentals and more skill-based exercises. And then the final step is just returning to full contact practice. And so again, it's something that takes time. We're not progressing a step more. We're not going more than one step in a 24-hour window, and we're making sure that symptoms are not worsening and that they're remaining symptom-free, really, in general, as they go through that.
Yeah. It's a fantastic program. And as we go through a lot of the different services that are available for student athletes, we've done a lot of podcasts in the past, both for providers and for parents, on a lot of these things where we really go into detail on just that one specific thing. And we're going to have links in the show notes to all of those programs, and I'll just mention them as we go through. One of those is just on sports-related concussions in general. What are they? What causes them? What's happening at the cellular level? What symptoms does that cause? What can you expect the course of recovery to be? And then we also have one on specifically concussion recovery and return to play. Both of those, are probably close to an hour of material just on their own right. And so again, we'll put links to that in the show notes for you. Another one that I find interesting, one of the programs that you guys have, and it really goes to what Eric was saying earlier, that it's not always just your traditional athlete that you think of, like basketball, football, lacrosse, even martial arts and competitive dance. You have a performing arts therapy program that's part of sports medicine, and it's really for dancers, cheerleaders, gymnasts, musicians, because we know marching band in many ways could be considered an endurance sport. Tell us a little bit about that program.
Yeah, actually, that's one of the programs that I was fortunate enough and lucky enough to be able to start here within sports medicine was our performing arts medicine. As you mentioned, Mike, they are athletes. Number one, dancers are athletes. They love that. However, it's a different class of athlete. What we see that a football player, that a soccer player needs for their body wouldn't even scratch the surface for most dancers. The strength requirements, the flexibility requirements, what we would consider good flexibility in a soccer player would be horrible for a dancer. And of course, what they have to do with their body can be a lot more intense. A great example is ballet. I absolutely love ballet. It's beautiful. However, the human foot was never meant to stand on point. The bones were not set up to do that. And while it is beautiful and amazing, it can be very tough on the body and very damaging if things aren't as best as they can be. But it is a unique population. And so they have to know that you know what you're talking about. And we are very lucky to have some physicians here within sports medicine that do specialize in working with dancers and really understand where they're coming from. But as you mentioned, not just dancers, but martial arts, again, different requirements of the body, the balance, the agility, the flexibility and power. Musicians, as you mentioned also, not just marching band, which requires a lot of what we consider a straining position, how they have to move in a military posture with their shoulders held super tight. Their feet may actually be lifted the entire time, toes up. It can cause a lot of overuse injuries. But also even, our kids who perform on stage in shows, in musicals, of course, the dance and the work they're doing there, and our orchestra musicians. If you think about your first chair violin, they're generally sitting forward, perched on the edge of their chair, holding that violin or viola to their shoulder, so they have their neck in an awkward position with their arms held in a very tight frame. And again, those hours and the repetition do add up.
Yeah, absolutely. No question about that. And for those out there who are more interested in hearing more about performing arts therapy, we also did a PediaCast on martial arts and competitive dance and the injuries that you typically see and what rehabilitation looks like for them. And we'll put a link to that in the show notes for you. Runners, there's a lot of folks training right now for cross-country season, which will start up in the fall. We have a running mechanics evaluation program at Nationwide Children's. What in the world is that all about?
Well, that involves the evaluation. So taking a look at how they're moving, how their feet strike the ground. There's multiple phases that we look at within a run. We can literally break it down to 12, 13, 14 different phases simply with each step during a run. So just like the rest of functional rehab, we're looking at all their physical capabilities, their range of motion, their flexibility. But when you take a look at running mechanics, there are so many other things to consider. The heel strike moment, the loading phase, the stance phase, the swing through, and on and on and on, down to you're looking at the extension range of motion of the great toe. And having that even just slightly off at the end of that toe off phase when you're running adds up, and it works its way through the system. So as we know, that whole kinetic chain all starts to affect each other. And you can have just the slightest difference. A phrase I like to use to describe it to the parents and the kids, I call it my Kleenex theory. So, you go inside and outside in the fall, it's warm, it's cold, it's warm, it's cold. You wipe your nose because maybe it runs for a second. Doesn't bother you. It's nice and soft and fuzzy. Blow your nose every 10 minutes for 2 days straight. Now what does it feel like? Right? So a tiny change in your mechanics and the way you're loading, and that heel strike is a multiple 3 to 4 times your body weight with every strike. You do that enough times, and even the slightest change in your mechanics or slightly off kilter is going to add up and can turn into a long-term injury.
Now, the feet are moving kind of fast as you're trying to evaluate
Very
this.
much.
But you use a biomechanic video motion analysis. Tell us about that. That sounds fancy.
Yeah, well, it is. We actually use different camera systems. So actually, ironically, we're able to use iPads. iPads actually have a multiple high frame camera system built within them, but we have a specialized software that lets us record it. And we typically record from at least 3 different planes. And then we can actually slow it down frame by frame and actually use a scroll wheel to move it frame by frame, even stop, draw on the screen. We can kind of go sports telecaster and draw on the screen, even place a goniometer the same way you would do measurements for imaging, for radiology. And we can actually show angles and differences. And it really helps us to break it down. But again, we also get to use that then with them. I show them what we're doing, and I can hold that mirror up. I can show the kid and the parent and go, this is what's happening, because you can't see your own feet when you're running. So it really helps to be able to illustrate what is going on and when, which makes it a little easier to correct.
Yeah, yeah. When you think about these really repetitive motions, there's a lot of muscle memory that's involved. I mean, you don't necessarily think about running when you're running. Is it difficult to try to change one particular part of their running mechanics? You mentioned, like extension of the great toe. Like, I would imagine from the student athlete's point of view that it's really would be difficult to make a change and keep that change with every step when it's something that is so automatic.
Yeah, I mean, it becomes ingrained. I mean, let's face it, we work on habits, You don't sit around thinking about making your heart beat and breathing. Otherwise, you just lay on the carpet. But it does. It takes a lot to break that habit. The old phrase, habits are hard to change, come in. And you have to reprogram the body's muscle memory through repetition, through exercise and drills. Sometimes it's habitual. Sometimes that habit is backed up by restrictions, like we talked about earlier with the athletes. Certain range of motion. If they have a habit of running toe out, well, the external rotators for their hip have become a bit too active, a bit too tight, and the internals are not tight enough. So taking the time, it can take weeks, sometimes up to months, of them also doing their homework at home, doing their HEP, which we need them to do, and helping correct and ease that back into place.
Yeah.
We use that. We use a lot of cueing, a lot of visualization. But like a lot of things, it's repetition, just like everything else in your sport or your activity. You can't just do it once and be an expert. So it takes that repetition time.
I'd say too, it's really important with these kids to just start small. You can, go through the whole video analysis and you can see, 5 or 6 major errors, and that can really overwhelm someone. So it's really important to just give them some little pieces to start working on, something small, focus on that one thing. And I tell them, I usually start with the most important thing or the most egregious error that you might see. And it's like a domino, once you fix that one thing, then sometimes the rest just kind of fall into place. So it's important to just give them little tiny things to work on, give them a specific corrective to work on, to focus on, and then the rest kind of falls into place, and it makes the whole process easier for them.
Yeah, that really makes sense. As we move from the legs to the arms, we had mentioned baseball and softball throwing evaluations. Eric, tell us a little bit more about that program.
Yeah, that's one both Jesse and I work quite a lot in that space, and very similar to what we were just talking about with running. Throwing can very quickly turn into a bit of a mess. You double down with the fact that you're dealing with the glenohumeral joint, which is the most unstable joint in the body, coming off of the most unstable platform, your scapula. Then you add in the fact that these kids are growing. So things are changing. Their mechanics are changing quite often. And what will happen is they will get into habits. For instance, one of the most classic things we'll find is a sidearm throw, and they won't be using the arm correctly. And we wind up with the scapulosomatoform dysfunction. So the muscles, the sequence that everything needs to work. We need the shoulder blade to sit and lock into place and be stable, so the rotator cuff has something to go from. So that's a classic series that I'll work with kids where we correct all those. We look for the range of motion, the flexibility, but I make sure that the muscles are firing in order to begin with. Then once we do have them pain-free, doesn't do us any good to start throwing them too early. Once I have them pain-free, then we get them out there, and we'll start with some very light throwing and watching how they move, again, without thinking. How do they naturally move? And then we can start making those small correctives at that point.
Yeah, and you use the video motion analysis for throwing as well as for running.
Yes. Yeah. We use it for quite a lot of things, actually. But yeah, throwing, running, I think, one of the others we'll talk about is swimming, even soccer.
And for folks who want to know more about throwing injuries, we do have a podcast on that as well, Throwing Injuries in the Young Athlete, PediaCast episode 513. And we'll put a link in the show notes to that one as well. You mentioned swimming. That, again, is one of those sports that you don't necessarily go straight to, unless, of course, you are a swimmer or come from a swimming family. But there's a lot that goes into muscle movement and repetitive motions and potential for injury with swimmers as well. Tell us about that program, the swimming analysis program.
I could take that one, Eric. Yeah. So again, we see swimmers come in with overuse injuries. A lot of times they're shoulder injuries or low back injuries in our swimmers. And these, again, are typically endurance athletes. They're in the pool for many hours a week. They're, doing different types of strokes, and the amount of times they're bringing that shoulder or that arm up over their head, you can't even count how many times in a week they might do that. So when they get into us, we're going to evaluate their mechanics in the pool. So we have access to a pool where we can get them in the water. And we, again, use our iPads, and we can look at several different strokes and break down those strokes and see maybe where they're failing, where in that kinetic chain they're lacking, because you're only as strong as your weakest point. And so a lot of kids, again, have that poor scapular thoracic control and that poor rhythm in their arm, or they have a really gooey, as we like to say, core. Those young growing kids haven't yet found that strength in their core. And so they try to compensate by using other muscles. And then those muscles get tired. They fatigue really quickly. And that leads to overuse issues. So we want to really hammer endurance with those swimmers and getting them in the water and giving them specific correctives that can help take the stress off their shoulder or their back, whatever might be bothering them.
Yeah.
And another part that goes with that, so it goes with the throwing and goes with the swimming too, with any athlete, but it's magnified in any of our upper extremity athletes, is posture. We have so many kids that come and walking in the door, and we see this everywhere, not just the kids, but adults too. And modern technology, cell phones, isn't helping it, but this forward posture, the shoulders forward, head forward, we wind up again with that imbalance. So when they're trying to do as much rotation and circumduction of the shoulder, if you have that imbalance between anterior to posterior and across the body, that really does add up to it too. So that's always one of the big things we have to correct.
Yeah, absolutely. As we think about upper body and athletes, in addition to swimming, volleyball, and golf even, you guys take care of some golfers and help them improve their golf swing, right?
Yeah, we actually have a golf medicine program here. So we have three clinicians. One of our doctors, Dr. Drew Dewerson from our sports medicine department. We also have one of our athletic trainers and one of our physical therapists are all Titleist Performance Institute, TPI certified. So they went through the Titleist medical track to really dive into a golfer's specific injuries. So they look at everything that every athlete's capable of getting, as well as those specific ones. Yeah.
It's so interesting. And we actually did a podcast on that as well, golf medicine. And that was just a fascinating one for me, because if you're not a golfer, it's something you don't really hear about too much. And so I learned a lot from that particular podcast, and I'd encourage folks to check it out, and we'll have a link to it in the show notes for you. We also have an injury prevention program at Nationwide Children's. Who is that particular program for, and what happens during it?
So we did, in the past, we had some of our athletic trainers who are outreach athletic trainers at the high schools reach out to us who had been having a lot of injuries, maybe more specifically with their baseball team. And so myself and another athletic trainer, we actually went out to the school. We did a 6-week program with their baseball team and just gave them some tools. We looked at everybody's throwing mechanics. So one by one, we took them out and had them throw. We brought our iPads with us, and we broke them each individually down. And then we gave them a sheet to go over what we saw. Again, the most obvious flaws in their mechanics, and gave them some things to work on. But then outside of that, we had about an hour session where we worked on mobility exercises. We worked on some power, some rotational exercises, some things just to fine tune their mechanics and the muscles and the movements they might most commonly use in their sport to hopefully prevent those injuries or minimize the risk of those injuries throughout the season. So it's an off-season program, and it's something that just was brought to our attention that it was a need to help address these guys who were just seeing a lot of injuries, a lot of issues during the season. So we're also working on an ACL program as well, and hopefully we'll be able to get that incorporated to some of our outreach schools, our contracted schools as well, working with some basketball teams, some volleyball teams, the teams that see the highest rate or highest incidence of ACL injuries, and just working on jump landing mechanics, change of direction, deceleration exercises, again, fine-tuning those movement patterns to help reduce the risk of that injury.
Yeah, absolutely. So these are not kids who have an injury. These are ones that, or even maybe they haven't had a history of injuries, but they're at risk because of their particular sport and their age. And so you're going to look at their mechanics and teach proper technique in order to try to prevent injuries. That is so important, and such a unique program. And I would imagine, as you mentioned, you're working on strength, flexibility, agility, endurance, all the things, right?
Absolutely. We're hitting everything that could be involved in their sport, which, again, it's a whole kinetic chain. We look at everything from the floor up. We're hitting balance. We're hitting neuromuscular control, agility, coordination, endurance, all those things.
And as you're describing this, I'm thinking of the typical sort of high school athlete, but you also take care of younger kids too, right? How young when would you start an injury prevention program?
Yeah, so our sports medicine team sees kids as young as 5 years old, all the way up into the college age. And really you're seeing injuries at all those ages. If they're physically active, they have the opportunity to get hurt. And so there's no wrong time to start an injury prevention program. There's always things that they can work on. There's always, small strengthening exercises they can do, stretching exercises they can do, balance, coordination, that can start, again, at any age. If you're physically active and you're moving around, you're playing, even if it's free play, playground play, recreational sports, there's things that you can do to help fine-tune and coordinate your movements to lower your risk for injury.
Yeah, absolutely. Some of the literature mentions age 10 and older. Is that just arbitrary? There's probably no research behind like what age to start something like that, right?
To be fair, I don't know that there's a ton of research in the younger age group. When you get younger than that, I think so much of it looks at organized sport. Where there's actual teams and there's competition, and you miss that 5-6-year-old who's just running around in the backyard playing, or going to the playground or going to a ninja course. And so I think that's one of the areas of research that's lacking. And so it's hard to get an idea of what the need might be if we don't know what's going on in that age group.
Another one of the programs that I find really interesting is our Play Strong program at Nationwide Children's. What is Play Strong, Jesse?
Play Strong is a really awesome, unique program that we started here at Nationwide Children's. It's a program for kids who are not physically active, who need more physical activity in their lives. And it's a way to get them to improve their thoughts about physical activity. Maybe they're not physically active because they've had a negative experience with physical activity, or maybe they feel uncomfortable with certain movements or certain sports because they haven't done it before. So it's a program where kids are coming in, they're coming from healthy weight nutrition, they're coming from other departments within the hospital. Maybe they're coming off of some cancer treatments and have been on some steroids, and so they've had some weight gain, or they've been physically deconditioned and they're just trying to get back to activity once again. But these kids come in and it's a 12-week long program. It's 2 days a week. It's an hour-long session, and we're just exposing them to as many different ways to be physically active as possible, different games, games that they might play out at recess or on the playground, and then also your organized sports, your baseball or wiffle ball as we use it, and kickball, dodgeball, or football, baseball, all these sports. And we just want to show them ways that they can be physically active on their own or with friends and have a positive experience with it. We want it to be, we want them to enjoy it. We want them to seek out physical activity and kind of change the way they think about it so that they have a positive connotation with being physically active. And it's not something they, we want it to be something they look forward to doing and they enjoy coming to class.
Yeah, absolutely. And we'll put a link to PediaCast episode 297, where we go into lots of detail about our Play Strong program and some other unique programs at Nationwide Children's as well. So be sure to check that out. We'll put that in the show notes. Another area that we have talked about before that is so important is strength training and strength and conditioning programs. And we have a couple episodes on those things too that we'll put in the show notes. But give us an overview of our sports performance program, which really looks at strength and flexibility and all of those things. Jesse, tell us about that one.
Yeah, so we, within our sports medicine team, we have an amazing group of strength and conditioning specialists. And so one way that kids can come in who maybe haven't sustained an injury or aren't having any pain, but specifically just want to work on sports performance or becoming more agile or increasing their speed, they can connect with our strength and conditioning specialists, and they can, purchase a package with them to work individually, one-on-one. They can even work as a team if they go that route, and they're just going to address whatever specific need or want that they have. If it's getting stronger, if it's technique in the weight room, if it's speed and agility, they're going to address those things and work with them on an individual or team basis to improve those deficits.
And I would imagine here age might be a little bit more important because you have to at least be old enough to follow directions and do things safely, especially if you're talking strength training, right?
That's right. And so typically we see those kids in the middle school and up age range, so 12, 13 years and up. We'll see them as athletic trainers as well at times. Again, they have the opportunity, maybe they don't have any pain or not having any issues with their sport, but maybe they are an overhead athlete, a thrower, and they want to look at their mechanics to see if there's things that they can do better to be more efficient, to improve their performance. So we also have throwing performance packages where instead of working with the strength and conditioning specialist, they'll be working with us, an athletic trainer, and we'll take them through, again, whatever they want to do. If they want to work on power, control, those things. But yeah, it gets tougher when you're younger to hold focus and to be as motivated to do that extra work. So we typically don't see those younger kids in this area.
And that makes sense. Eric, we kind of touched on this before, but I just wanted to get your insights. Here in Central Ohio, we have all these fabulous programs through the sports medicine program at Nationwide Children's Hospital. But for folks who are not necessarily in our area, maybe this is a family in a suburb of Omaha, Nebraska, let's say. How do you go about, finding these kind of services in your local area? Obviously the Children's Hospital and a sports medicine program like ours is one way, but are there other ways that we can find help that may take a little more creativity if there's not a well-developed program like we have here?
Yeah, luckily there's actually been quite a few programs that have actually have visited us and actually modeled their programs after us. As you mentioned, like children's hospitals and other sports medicine programs. Outside of larger established programs like that, like you said, getting a bit more creative would be, if you happen to be at a middle school or high school level already, if there's not a major program in that area, is talking to your athletic trainer. Go to your athletic trainer at that school, find a time to sit down with them and ask them some questions. It might be something that they can do on a side basis or work with them or have the advice for you as where to do it. If they're dealing with an injury already, obviously seeking out, professional help from your physician, and or physical therapists. But, I said the athletic trainers in the area should be able to guide them into the right place to look for it if they don't have an established program.
Yeah, yeah. So talk to your child's doctor for one, because this is whatever issue your
Definitely,
child
yes.
has. They've probably seen it before and
Yeah.
have an idea of where they can refer. And the advantage I think too for the individual primary care physicians is they also get follow up and feedback, so they can be like, oh, this program is particularly useful, or if maybe there's a program that parents have not had as good of an experience, and your physician by seeing all those varieties of outcomes may have some insight into what's available in your particular area. And then I love the idea of talking to your athletic trainers at your school, because you may not have a concussion return to play program locally, but there is plenty of literature online about how to conduct one of those programs. And maybe an athletic trainer at your school has done that for folks before. And, if you talk to one of the athletic trainers, they may say like, oh, Lauren has a particular interest in concussion return to play stuff. You should talk to her. So, just really networking and talking to those people that are immediately available, that they may have insight that you would not have any clue about.
Exactly. Yeah. But definitely use those resources. Like you said, your pediatrician, your family doctor, they're going to know who to talk to, who the best one. But those resources are out there. And of course, they can always come to our websites. We always have tons of information for that. And, if we don't have it, or if we're not in your local area, we generally know who is. It's a fairly tight-knit community.
Yeah, absolutely. And speaking of sports medicine in general at Nationwide Children's, it's such a fantastic, well-developed program. Tell us a little bit more, in addition to functional rehabilitation, some of the services that you guys offer.
Yeah, it really has grown. So over the past 22, 23 years, when it started with our boss, Lisa Kolechorowski, and our chief, Dr. Tom Pommering, and now the size as it is now. Besides the traditional sports, we work hand in hand with orthopedics. We work hand in hand, of course, with physical therapy, our dietitians, the entire Play Strong program. Another terrific facet, and I'm lucky enough to be involved also, is with our adaptive sports medicine program. So a lot of people out there, you might be thinking of like the Paralympics. So whether these are young athletes with an acquired amputation, for instance, or congenital, finding ways for them to do their adaptive sports, whether it's adaptive skiing and the track, the wheelchair racing, rugby, etc. So we work a lot in that space with one of our physicians who specializes in that. Of course, we have the dance medicine, performing arts, just all of the sports, all the way down to, as you mentioned, the injury prevention. We want to make sure that, as Jesse said, anyone that is physically active. So it doesn't matter what you do. It doesn't matter if you're, kicking the winning kick for the varsity game or playing kick the can. We have a way to get you where you need to be and make sure that you can go out and do whatever it is you want to do, pain-free, healthy, having fun, and also give them the resources to avoid injury if at all possible, and when necessary, recover from that injury so they can return.
Yeah, absolutely. And we'll put a link to the sports medicine program at Nationwide Children's Hospital in the show notes, and also to the functional rehabilitation program for student athletes. You'll find all of that in the show notes over at PediaCastCME.org. And it'll include a link to all the other podcasts that I had mentioned before, both ones for parents and ones for providers for CME credit, related to all of these different programs that we have that intersect with functional rehabilitation. So once again, Eric Leighton and Jesse Parthemore, both athletic trainers with Nationwide Children's Hospital, thank you both so much for stopping by today.
Thanks for having us. We enjoyed it.
Thank you. It was a pleasure. Thanks for highlighting us. We appreciate it.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast CME a part of it. Also, thanks to our guests this week, Eric Leighton and Jesse Parthemore, both certified athletic trainers at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCastCME.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our CME information, our terms of use agreement, and that contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show. And we love connecting with you on social media. You'll find us on Facebook, Instagram, Threads, and LinkedIn. Simply search for PediaCast. You've listened to the podcast. Now be sure to claim your free Category 1 continuing medical education credit. It's an easy thing to do. Simply head over to the show notes for this episode at PediaCastCME.org. You'll find a link in the show notes to the post-test, and just follow that link to Cloud CME, take and pass the post-test, and the Category 1 credit is yours. By the way, there's been a little bit of a change. When you do go to Cloud CME, it used to be the post-test was right there on that page, but there was an update, and now you actually have to click Materials, and you'll find the post-test under the Materials tab. So still super easy. Again, we offer credit to many pediatric professionals, including doctors, nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. Of course, you want to be sure the content of the episode matches your scope of practice. Complete details available at PediaCastCME.org. Also, don't forget about our evidence-based podcast for parents. Lots of pediatricians and other providers also tune in as we cover pediatric news, answer listener questions, and interview pediatric and parenting experts. Shows are available at the landing site for that program, PediaCast.org. Also available wherever podcasts are found. Simply search for PediaCast. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay informed, keep it evidence-based, and take care of those kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast CME.